Welcome to Health Builds Life. Today, we explore 8 hidden warning signs of a mysterious autoimmune condition known as Sjögren's syndrome. In this complex condition, your own immune system mistakenly attacks the delicate glands responsible for producing essential moisture in your body. Millions suffer in silence without knowing the true cause of their daily discomfort, attributing these persistent symptoms to simple aging processes. Recognizing these early warning signals can drastically improve your quality of life and prevent severe long-term complications from secretly developing further. Let us dive deep into the first major red flag that often drives frustrated patients to seek professional medical help immediately. The first prominent symptom is chronic dry eyes. You might constantly feel as if tiny grains of sand are trapped inside. This irritating, gritty sensation persists throughout the entire day, making simple tasks like reading or watching television feel incredibly exhausting now. Severe sensitivity to bright light is another crucial indicator. Stepping into normal sunlight suddenly becomes a painful and overwhelming visual experience. Patients often report sudden episodes of blurred vision, which severely disrupts their ability to focus on computer screens or driving safely. Regular eye drops usually provide only temporary relief, failing to address the underlying autoimmune destruction happening within your vital tear glands. Without adequate tear production, the delicate surface of your eye becomes highly vulnerable to dangerous infections and permanent corneal scratch damage. If you find yourself constantly rubbing your irritated eyes to find relief, it might be time to investigate this hidden syndrome. Your eye doctor might notice these specific dry patches during a routine exam, prompting further investigation into your overall immune health. The second major warning sign is a persistently dry mouth. Saliva production drops significantly, leaving your mouth feeling like a desert. Swallowing dry foods like crackers or bread becomes a tremendous struggle without taking large sips of water to wash them down. Saliva naturally protects your teeth from harmful bacteria. When it disappears, patients often experience a sudden and devastating spike in cavities. Even with excellent dental hygiene, you might find yourself needing multiple fillings during every single visit to your trusted local dentist. Another distressing oral symptom is a severe burning sensation on your tongue, which makes eating spicy or acidic foods completely unbearable. Your voice might become noticeably hoarse after speaking for just a few minutes, forcing you to constantly clear your dry throat. Nighttime brings even more discomfort as you wake up repeatedly with a mouth so parched that it disrupts your precious sleep. Many individuals mistakenly blame their medications or dehydration, completely missing the underlying autoimmune attack, destroying their precious salivary gland function entirely. Recognizing this severe lack of saliva early can save your teeth and restore your ability to enjoy normal meals without pain. The third alarming sign involves complex neurological manifestations. The disease can extend far beyond simple moisture glands to attack your nerves. You may experience uncomfortable numbness or tingling sensations in your hands and feet, a condition officially known as peripheral neuropathy today. This strange tingling feels like thousands of tiny needles piercing your skin, making walking or holding objects feel incredibly awkward sometimes. Another neurological symptom is severe brain fog. You might suddenly struggle to remember simple words or maintain focus on daily tasks. This profound cognitive fatigue is not just normal tiredness. It feels like a thick cloud heavily obscuring your normal mental clarity. Patients also frequently report experiencing intense, debilitating headaches that refuse to fade away even after taking standard over-the-counter painkillers. These neurological issues occur because the rogue immune system triggers widespread inflammation that directly damages the protective lining of your nerves. Ignoring these nerve signals can lead to permanent damage, making early diagnosis and targeted medical intervention absolutely critical for your future. If you constantly drop things or feel mentally exhausted without reason, your nervous system might be crying out for immediate help. The fourth hidden warning sign involves your cardiovascular system. Sjögren's syndrome can silently trigger dangerous inflammation around your vital heart muscle. This condition, called pericarditis, causes sharp chest pain that worsens significantly when you take a deep breath or lie down flat. You might mistake this intense chest discomfort for a sudden heart attack, leading to terrifying emergency room visits in the night. Rhythmical disturbances are also quite common. Your heart might suddenly race, flutter, or skip beats without any obvious physical exertion beforehand. These irregular heartbeats can leave you feeling extremely dizzy, breathless, and overwhelmed with unexplained anxiety during your normal daily routine activities. Chronic systemic inflammation slowly damages the delicate blood vessels, significantly increasing your overall risk of developing long-term cardiovascular complications eventually. Doctors must carefully monitor your heart health if you have this autoimmune condition to prevent these silent inflammatory attacks from escalating. Maintaining a healthy diet and managing stress levels becomes even more vital when your heart is under constant threat from inflammation. Never ignore any sudden chest pains or strange palpitations. They are urgent messages from a cardiovascular system struggling against autoimmune forces. The fifth major symptom is severe joint and muscle pain. This discomfort often mimics other famous autoimmune diseases like rheumatoid arthritis. You will typically feel this deep aching pain symmetrically, meaning it affects both of your wrists or both knees simultaneously today. Morning stiffness becomes a daily nightmare. You might struggle to get out of bed, feeling completely locked up for over an hour. Simple morning tasks like buttoning your shirt or holding a coffee mug become painful challenges that drain your energy almost instantly. Unlike normal muscle soreness from exercise, this persistent joint pain lingers for weeks, slowly eroding your physical mobility and overall happiness. Swelling and noticeable redness around the affected joints might also appear, clearly indicating active inflammation raging deep within your bodily tissues. Many patients are initially misdiagnosed with general arthritis before doctors finally connect the joint pain to their dry eyes and mouth. Gentle exercises like swimming or yoga can help maintain joint flexibility, but proper medical treatment is required to stop the damage. Listening to your body when it aches symmetrically is crucial for uncovering the hidden systemic nature of this complex autoimmune disorder. The sixth warning sign targets your respiratory system. Lung disease is a serious and potentially life-threatening complication of Sjögren's syndrome. You might experience sudden shortness of breath during mild physical exertion, like simply walking up a short flight of wooden stairs. A persistent, irritating dry cough that never seems to go away is another hallmark symptom indicating dangerous inflammation inside your lungs. This occurs because the immune system attacks the delicate lung tissues, causing a severe condition medically known as interstitial lung disease. Over time, this chronic inflammation leads to permanent lung scarring, severely reducing your overall lung capacity and making every breath extremely difficult. Patients often feel a heavy tightness in their chest, completely unrelated to any standard viral infections or common seasonal allergy symptoms. Early detection through specialized pulmonary tests is absolutely vital to halt the progression of this irreversible and debilitating respiratory tissue scarring. If you find yourself constantly gasping for air without reason, your lungs might be silently battling a fierce autoimmune attack deep inside. The seventh critical sign is hidden kidney dysfunction. Your kidneys silently filter waste, but this disease can severely impair their essential function. One common symptom is waking up multiple times during the night to urinate, completely disrupting your essential and restorative sleep cycle. The inflamed kidneys gradually lose their vital ability to properly regulate the delicate balance of acid and potassium within your bloodstream. This dangerous chemical imbalance frequently leads to the painful formation of kidney stones, causing agonizing pain in your lower back area. You might also experience extreme unexplained fatigue and muscle weakness as your blood becomes increasingly acidic due to failing kidney filtration. Routine blood and urine tests can easily detect these hidden abnormalities before the delicate kidney structures suffer permanent and irreversible structural damage. Drinking plenty of water is helpful, but specific medical interventions are necessary to protect your kidneys from the relentless immune assault. Never ignore changes in your urinary habits, as they serve as vital early warning signals for underlying systemic autoimmune kidney complications. The eighth and final warning sign involves severe blood manifestations. Sjögren's syndrome can drastically alter your fundamental blood cell counts silently. Chronic anemia is incredibly common, leaving you feeling constantly exhausted, pale, and completely drained of energy despite getting enough nightly rest. You might also develop leukopenia, a dangerous drop in white blood cells that makes you highly susceptible to catching frequent infections. However, the most terrifying blood complication is a significantly elevated risk of developing a specific type of cancer known as lymphoma. Patients with this syndrome face a staggering 14 to 44 times higher risk of lymphoma compared to the general population. Persistent swollen lymph nodes in your neck or armpits, accompanied by drenching night sweats, require immediate and thorough medical cancer screening. Regular hematological checkups are an absolute necessity to monitor these severe blood risks and catch any malignant transformations at very early stages. Sjögren's syndrome is far more than just dry eyes and a dry mouth. It is a complex, full-body systemic battle. If you recognize these 8 warning signs, Please consult a specialized rheumatologist immediately to protect your long-term health and overall vitality. Thank you for watching Health Builds Life today. Stay informed, listen to your body, and we will see you next time.